My name is Manuela and I'm a public health nurse with the City of Hamilton Public Health Department. And one of the things that we do as part of the child safety team is that we educate parents about proper use and installation of car seats. So today I'm going to talk to you briefly about booster seats. Booster seats protect against serious injury 3.5 times better than seat belts alone. Booster seats are required for children who are under the age of 8, who weigh between 18 kilograms and 36 kilograms or 40 to 80 pounds, and who stand less than 145 centimeters or 4 foot 9 inches tall. Booster seats work in that they help to raise the child up so that the adult seat belt can fit them properly and therefore will work more effectively. All booster seats should be used with a shoulder lap combination seat belt. Your child's head must also be supported by the top of the booster seat, the vehicle seat, or a headrest that's available in your vehicle. The shoulder strap must lie across the child's shoulder. It should not be close to the child's face or neck and should cross at the middle of the chest and then lie low on the pelvic area or over the hip bones, not anywhere near the stomach or abdomen. Never use seatbelt adjusters. Just as some important tips to keep your child safe and secure. Make sure that you use the right seat for your child's height and weight. Always follow your manufacturer's instruction for correct use and installation of your car seat. Be sure to secure your child correctly. Make sure that the harness straps are snug and tight, and keep children away from active airbags available in the vehicle. An important thing to remember is that children under 13 years of age should always sit in the back of the seat, as we know this is the safest area of the vehicle. Just a couple of things to keep in mind if you're thinking about buying a second-hand car seat. Make sure that you do a little bit of research. So use a bit of caution when using or thinking about using a second-hand car seat. You may want to consider getting it new or from someone that you know, and make sure that it is checked carefully. Be sure that the instructions are available and that all the parts of the seats are present. It should not be in a collision, and you also want to make sure that the Canadian Motor Vehicle Safety Standard sticker is visible on the car seat. Check to make sure that your car seat has not expired. All car seats do come with an expiration date, so please check for that. Look for discolorations in the plastic or cracks, and make sure that the harnesses are not worn or torn. A couple of things that you may be interested in that Public Health Services provide are car seat clinics. Usually we run them from early spring until late fall. You can check or call the Health Connections information line for dates and times. The other service that Public Health provides are evening education sessions. And again, you can call our health information line at 905-546-3550 and ask for Health Connections to find out dates and times. Thanks. Emma is 6 years old, and by looking at Emma, you might think that she's ready to sit in a seatbelt alone. But in fact, Emma is not tall enough to be sitting in a seat belt. So we've placed Emma in a booster seat, and what the booster seat does is it helps to raise her up so that the lap and shoulder belt of the vehicle will fit her properly. So if you look at the lap belt, it sits low on her hips away from her stomach or abdomen, and this is where you want the lap belt to sit on your child. The other thing about booster seats, because it helps to raise them up, your child will be able to see out the window and will sit more comfortably for your trip.